Welcome to our deep dive today. We're going to be looking at
Huh?
Dr. Birru's notes on examination techniques and mental status assessment. Basically, like how healthcare pros figure out what's going on with a patient.
Yeah. It's like detective work, really. There's two main approaches. You've got your focused assessments,
Mm-hmm.
which zero in on a specific complaint, like, that sore throat you were talking about before. And then there's the head-to-toe comprehensive assessment.
Okay, so like focused is if you come in with like one specific thing. What makes the head to toe so comprehensive?
Well, it's like a full body scan. It hits all the major systems. It helps uncover any underlying issues
Okay.
that might not be obvious at first glance. It's all about connecting the dots, seeing the big picture.
Okay, cool. So where do you even begin with something that big, does Dr. Birru's note say?
Oh, absolutely. Dr. Birru really emphasizes that before you even touch the patient, building rapport is key.
Right.
Making them feel comfortable, earning their trust, creating an environment where they feel heard and respected.
Yeah, that makes sense. Like if you're all tense and uncomfortable, you're probably not going to tell them everything, right?
Exactly. And while you're chatting, building that rapport, you're also doing a general survey,
Okay.
taking in their appearance,
Yeah.
posture, signs of distress, hygiene, all of it.
Oh, wow.
It's amazing what you can learn just from observation.
Like those little clues in a mystery novel, right?
Yeah, exactly.
Foreshadowing. So what happens after that? Does Dr. Birru's note go right into vital signs?
Not quite. Dr. Birru's note, they stress the importance of asking about pain
Okay.
while you're gathering those baseline vitals.
Right.
And remember, pain is subjective. It's whatever the patient says it is.
Yeah. Pain is so personal. Like what works for one person might not work for another. And how you feel pain is just so different for everybody. So how do you even assess something like that?
Well, Dr. Birru actually goes into this in detail in their notes. It's not just asking, do you hurt? It's about understanding the history of their pain, location, intensity, how it impacts their life. There's pain scales to gauge intensity, but even those, they need to be considered in context.
Yeah, it's not just like a check mark. Right. So on to the vitals themselves.
Yes.
Temperature, pulse, respiration, blood pressure, oxygen saturation. Anything interesting in Dr. Birru's note about how these are measured?
Oh, definitely. For example, Dr. Birru mentions that temperature can be taken in a few different ways. Orally, under the tongue, axillary in the armpit, tympanically in the ear, and rectally.
Okay.
Each method has pros and cons. Accuracy can vary.
I've always wondered about that. Why so many ways? And does it really matter which one they use?
It absolutely can. So rectal temperatures tend to be the most accurate, but, they're not always the most practical or comfortable. Oral temperatures are pretty common, but things like drinking hot or cold beverages can throw off the reading. So choosing the right method depends on the patient's age, condition, and comfort level.
It's a judgment call. Okay. What about blood pressure? I've always been a little fuzzy on what those two numbers actually mean.
Well, Dr. Birru breaks it down nicely in the notes. So the top number, the systolic pressure, represents the pressure in your arteries when your heart beats, like the peak pressure. And then the bottom number, the diastolic pressure, is the pressure when your heart rests between beats.
So it's like working and resting. Got it. I feel like we're putting the pieces together. What's next?
Well, after vital signs, Dr. Birru's notes talk about biographical data.
Okay.
Basic stuff, name, date of birth, gender, contact info.
Yeah.
It's really important for record keeping and patient safety.
Right. It's like the framework, right? And then I guess that's when you start diving into health history.
You got it. Gathering those clues, past medical history, surgeries, allergies, family history of illnesses, lifestyle choices.
Right.
All that helps build the picture of their health risks.
It's amazing how much info you get even before you really get started with the exam.
Mm-hmm.
Does Dr. Birru's note talk about safety at all at this stage?
Oh, absolutely. Dr. Birru emphasizes standard precautions like hand washing, wearing gloves, using personal protective equipment. It's all about protecting both the patient and the healthcare provider.
Right. Safety first. But aren't there different precautions depending on what's going on?
Oh, you're right. Dr. Birru also talks about specific precautions like contact precautions for infections spread through touch, droplet precautions for stuff spread through respiratory droplets, and airborne precautions for those that, linger in the air.
Okay.
So it all comes down to choosing the right protection based on the risk,
Okay, so it can escalate depending on the situation. It sounds like there's a lot of thought that goes into even the basic stuff.
There is.
Okay, so I'm guessing now we're finally at the point where Dr. Birru's note gets into, the actual hands-on assessment.
Exactly. We're talking about the four main techniques: inspection, palpation, percussion, and auscultation.
Okay, here we go. So starting with inspection, is that basically just looking at the patient?
Well, it's more than just a casual glance. Dr. Birru describes it as a systematic visual examination.
Okay.
Carefully observing the patient's entire body, looking for any signs that might be a clue to a health problem.
So what kind of signs? Give me an example from Dr. Bureau's note.
Well, for instance, Dr. Birru talks about jaundice. It's a yellowish tinge to the skin and eyes, and that can actually signal liver problems. But it's not just skin color. Posture can be a clue about musculoskeletal issues. Even how they breathe can tell you about their respiratory health.
It's amazing what you can pick up just by looking, like you're detective or something.
Right.
All right, so inspection is using your eyes.
Mm-hmm.
Then there's palpation, which is using your hands, right?
Yes. Palpation involves feeling different parts of the body. Dr. Birru talks about assessing things like temperature, texture, tenderness, and whether there's anything abnormal like masses or swelling.
So it's like you're getting information through touch, like it's an extra sense to go beyond what you can just see, right?
Yeah, that's a great way to put it. Dr. Birru mentions different types of palpation, too. Light palpation to assess surface characteristics, deep palpation for examining organs and deeper structures.
Okay.
And it's super important to be gentle, always mindful of the patient's response.
Yeah, you don't want to miss anything, but you also don't want to, hurt them, right? Okay, now I'm really curious about percussion. I don't really get that one.
It is interesting. Dr. Birru describes it as tapping on the body's surface and listening to the sounds that come back.
I'm having trouble picturing it. So they, tap on your chest or something, and how does that help?
It's all about the sound. Air-filled structures like the lungs, they create a resonant, hollow sound when you tap them. Solid structures like the liver make a dull thud. And then fluid-filled areas, they have a flat sound. So by listening to these sounds, you can get a sense of the size, shape, and consistency of what's underneath.
Wow. So you're turning the body into a drum to figure out what's inside. That's so cool. And finally, auscultation. So that's the one where you listen with a stethoscope.
Yes. Auscultation is all about listening to the sounds the body makes. Dr. Birru really emphasizes paying close attention to the heart, lungs, and abdomen.
Okay.
You want to listen to the pitch, intensity, duration, timing of each sound. Each sound tells a story about how that organ or system is doing.
So you're eavesdropping on the body, huh?
Exactly.
It's amazing how all these techniques work together to get that full picture.
They do.
Okay, so now we need to talk about the mental status exam, or MSE. Dr. Birru spends a lot of time on that. And it seems like a pretty big deal for evaluating cognitive, emotional, and psychological functioning.
It's a crucial part of a comprehensive assessment.
Yeah, so it's you're looking into their mind, right? What are some of the things you're looking at during the MSC? What does Dr. Birru say?
Well, it covers a lot. Dr. Birru breaks it down into key areas. The patient's appearance, their behavior, their speech patterns, how their mood is, their thought processes, and their cognitive functioning. It's basically a snapshot of their mental state.
Okay, I'm interested. Break that down a little bit. What are you looking for when you're looking at, their appearance during the MSE?
Appearance can tell you a lot. We pay attention to things like their dress, grooming, posture, and hygiene, just like Dr. Birru says in the notes. For example, if someone who's normally well-groomed suddenly looks disheveled, it could be a sign of depression. Or maybe some cognitive decline.
Yeah, sometimes you see those little changes in people when they're going through something.
Exactly. And just like we observe appearance, we also pay close attention to their behavior.
Yeah.
Are they restless or agitated? Are they withdrawn? Is their eye contact normal? Or is it, all over the place or non-existent? Dr. Birru's notes point out that these observations can give clues about things like anxiety, depression, maybe psychosis.
Oh, wow.
Or other mental health conditions.
So it's not just what they say, it's how they act, too.
Exactly. And speaking of how they say things, analyzing a patient's speech is another important part of the MSE, like Dr. Birru talks about in their notes.
Okay.
We listen to the rate, the volume, the tone. For example, rapid, pressured speech might point to mania, while slow, hesitant speech could be a sign of depression or even a neurological condition.
But you're analyzing the way they talk to see if there are any clues there, right?
Exactly.
Okay. What about mood and affect? I know those are important, but I always mix them up.
Yeah, it can be tricky. So mood is their overall emotional state, how they feel inside. Affect is how they express those emotions outwardly.
Okay.
We want to see if their affect matches their mood. Like someone might say they're happy, but their face and their voice say something different. That mismatch can be a big red flag, like Dr. Birru says in their notes.
It's like when someone says one thing, but their body language is saying something totally different.
Yeah, exactly.
Okay, so how do you assess something as complex as a person's thought process is? That seems hard.
It's definitely challenging, but it's super important. Dr. Birru gives some really good tips in their notes. We listen carefully to the content of what they're saying and how their thoughts flow. Are their thoughts logical and make sense? Do they jump around randomly? Do they get stuck on a particular idea? We're also listening for things like delusions, hallucinations, or any thoughts of harming themselves or others.
It's a lot. So you have to be really paying attention and know what to listen for.
You do.
And Dr. Birru says it's important to consider context, right? Like age and culture and all that.
Oh, absolutely. What might be considered abnormal in one context could be totally normal in another.
Right.
You know, certain cultural beliefs or practices could be mistaken for delusions if you aren't familiar with that culture.
Sure.
So it's important to be sensitive and remember that everybody has their own background and experiences.
Yeah, you can't just assume, right? Okay, now I'm curious about the cognitive functioning piece of the MSE. What does that involve?
Cognitive functioning is all about how well the brain is working. Dr. Birru highlights several things to assess: orientation, attention and concentration, memory, and abstract thinking.
So you're checking to see if all the parts of the brain are working the way they should.
Yeah, kinda.
Tell me more about how you assess those different areas.
Well, for orientation, like Dr. Birru says, we start with simple questions like, do you know your name? Do you know where you are right now? What day is it?
Okay.
These questions help us understand if they're oriented to person, place, and time. If they're struggling with those basic questions, it could mean they're disoriented or confused, which could be caused by a lot of different things.
Okay.
You know, from medication side effects to underlying health problems.
So it's like checking to see if their internal GPS is working, right?
Yeah, good analogy. And for attention and concentration, Dr. Birru suggests different techniques. You might ask the patient to repeat a string of numbers forward or backward, or spell a word backward, or do a task that needs them to really focus, like tapping their finger in a specific pattern.
Right, you're making them work a little bit.
Yeah.
And then there's memory, both short-term and long-term.
Right. Dr. Birru talks about different ways to assess those. For short-term memory, you might ask them to repeat a list of words or a story right after you say it. For long-term memory, you might ask about important events from their past or general knowledge they should know. The point is to see how well they can remember information.
So you're testing how well their memory is working.
Exactly. And then for abstract thinking, Dr. Birru mentions things like asking them to explain proverbs or to describe the similarities and differences between things. This makes them think beyond the concrete and consider more abstract ideas.
It's like making their brain really think.
Yeah.
Okay, so we've got orientation, attention, memory, and abstract thinking. Is there anything else for the cognitive part?
The last thing we check is insight and judgment, which we talked about a little earlier. So insight, as Dr. Birru explains it, means the patient's understanding of their own condition. Do they realize they're having symptoms of depression or anxiety, for example? And judgment is their ability to make good decisions, taking into account what might happen as a result of their actions.
So it's not just about finding problems, but also understanding if the patient knows about the problems and can make decisions about their own care.
That's it, exactly.
Wow, I've learned so much about the mental status exam already. Dr. Birru's notes are really helpful. Before we go any further, I just want to emphasize how important it is to understand all these assessment techniques for both physical and mental health. It's not just about what healthcare providers do, but it helps us as patients to understand what's going on and advocate for ourselves and our loved ones.
I couldn't agree more. The more we know, the better we can communicate with our healthcare providers, ask good questions, and feel more confident about getting the care we need.
It's like having a secret decoder ring for the world of healthcare, right?
Exactly.
The more we understand, the more involved we can be in our own health and the health of the people we care about.
Absolutely. It's about being partners in our own healthcare, not just, passively going along with whatever happens. So let's take a minute to think about what we've covered today.
Okay.
We've looked at all the parts of a comprehensive health assessment, starting with observations and vital signs, then moving to the physical exam, and then exploring the mental status exam. We've learned so much from Dr. Birru's notes, and we've got a much better understanding of how it all works. But we're not done yet. We'll be back soon to dive even deeper into specific parts of the assessment.
Great.
We'll unpack those little details and find even more interesting insights. So stay tuned.
Welcome back to our deep dive into Dr. Birru's notes on examination techniques and mental status assessment. Before we pause, we were talking about how understanding these techniques can empower us as patients.
Yeah. It's like getting a peek behind the curtain,
Yeah.
like seeing how healthcare providers actually approach a health assessment, kind of like having a cheat sheet. I like that, a cheat sheet for healthcare. So let's keep unpacking those assessment techniques, starting with inspection. Dr. Birru really emphasizes that it's much more than just glancing at the patient. It's very systematic, a thorough visual examination, head to toe.
So you're really looking for those subtle visual clues
Exactly.
that might point to a problem.
You got it. Remember how we talked about jaundice, that yellowish color of the skin and eyes?
Yeah.
Well, Dr. Birru explains that it's actually a buildup of bilirubin in the blood, which is a yellow pigment, and a healthy liver filters that out.
Okay.
So when it builds up, it can be a sign that the liver isn't working the way it should.
So that's the reason behind it. I always see doctors checking for jaundice, but I never really understood why.
It's all about the liver.
Okay. So besides skin color, what else are we looking for when we're doing inspection?
Well, Dr. Birru points out that a patient's posture can be really revealing. Like a hunched back, or if they're having trouble standing up straight, that could point to problems with the spine or muscles. Oh, interesting.
Even the way they breathe can tell us a lot about their respiratory health. Labored breathing, for instance, could suggest a lung infection or some other kind of respiratory distress.
It's like our bodies are always talking to us.
They are.
If we just know how to listen. Right.
Exactly.
Okay, so we've talked about inspection, which is all about looking. What's next on Dr. Birru's list?
Next is palpation. That's where we use our sense of touch to gather information. Dr. Birru describes different types of palpation, from a very light touch to assess the surface, to deeper palpation, which is used to examine organs and structures that are deeper inside.
So it's like you're feeling for things you can't see, right?
Right.
Like temperature, texture, or if anything feels tender,
Right.
or if there's anything abnormal like lumps or swelling. It's almost like reading Braille, but for the body.
I love that analogy. And it's so important to be gentle and respectful when you're doing palpation.
Yeah.
Always being mindful of how the patient is feeling and what they're telling you. After all, touch can be a very personal thing. You're in their personal space.
Right.
Okay, now I'm ready to tackle percussion. That's one I've always found kind of mysterious.
It is pretty interesting. So Dr. Birru explains that percussion is basically tapping on the body's surface and listening to the sounds it makes.
I'm trying to picture this. It's like the doctor is playing the xylophone on someone's chest.
Yeah, sort of.
But how do those sounds actually tell you anything? Like, what's the science behind it?
It's all about density. Dr. Birru points out that air-filled structures, like the lungs, they create a resonant hollow sound when you tap them.
Okay.
Solid structures, on the other hand, like the liver, they make a duller thud.
Interesting.
And if there's fluid, it makes a flat sound. So by listening to these sounds, healthcare providers can get an idea of the size, shape, and consistency of the organs and tissues underneath.
So you're using sound to create a map of the inside of the body. Wow.
It's like sonar, right?
Exactly. Okay, and the last one, auscultation. That's listening with the stethoscope.
Yes. Auscultation is all about listening to the sounds the body makes. Dr. Birru stresses the importance of listening to the heart, the lungs, and the abdomen very carefully, paying close attention to all the different aspects of the sound. The pitch, intensity, how long it lasts, and the timing.
So you're really tuning in to the sounds of the body, like listening to a symphony.
You got it. You're listening for the rhythm of the heart, the flow of air in the lungs, even the sounds of digestion.
And all of that can tell you something about how well the body is working.
Exactly. And when you put all four of these techniques together, inspection, palpation, percussion, and auscultation, they make a powerful set of tools for assessing physical health.
You've got 4 different ways of looking at the body.
Exactly.
Okay, let's switch gears back to the mental status exam, the MSE.
Right.
Dr. Birru seems to really think this is important, describing it as a structured way to evaluate a patient's cognitive, emotional, and psychological functioning.
It's a key part of a full assessment for sure.
Yeah, it's like you're getting a glimpse into how their mind is working, right? And we've already touched on some of the things that you look at during the MSE, like their appearance, their behavior, their mood, their speech, their thought processes, and their cognitive functioning. But I'd love to dig a little deeper into some of these areas, especially based on what Dr. Birru says in their notes.
Absolutely. Let's do that. So, starting with appearance, Dr. Birru notes that paying attention to how a patient dresses, how they groom themselves, their posture, and their hygiene can provide really valuable clues about their mental state.
Yeah, you can often tell when something's off with someone just by noticing those subtle changes in how they look.
Exactly. It can be a sign that something's going on, especially if it's a sudden change.
Okay, and what about behavior? What kinds of things are you looking for there?
Well, Dr. Birru's notes point out things like restlessness, agitation, withdrawal, and poor eye contact as potential indicators.
Okay.
These behaviors could be signs of things like anxiety, depression, psychosis, or other mental health conditions.
So you're really paying attention to both what they say and how they act, right?
Absolutely. And like we talked about earlier, analyzing their speech is another big part of the MSE. We're listening to things like how fast they talk, how loud they are, and the tone of their voice.
Yeah.
And we're looking for any patterns that might be important. Dr. Birru's notes mention that fast, pressured speech could indicate mania, and slow, hesitant speech could be a sign of depression or even, a neurological problem.
It's like analyzing their voice to see if it's telling us something.
That's a good way to think about it.
And then there's mood and affect. I know those are important, but I always get them mixed up.
They can be a little tricky. Mood is basically their overall emotional state, like how they're feeling on the inside. And affect is how they express those emotions outwardly.
Oh.
We want to see if the effect matches the mood. So, like, if someone says they're happy, but their facial expressions and tone of voice don't match, that can be a red flag.
It's like when someone says one thing, but their body language is saying something totally different.
Exactly. Like a fake smile.
Okay. So how do you assess something as complex as someone's thought processes? That seems really difficult.
It definitely is challenging, but it's so crucial. Dr. Birru offers some really helpful tips in their notes.
Okay.
We listen really carefully to what the patient is saying and how their thoughts flow together. Are they logical? Do they make sense? Or are they jumping around randomly? Are they getting stuck on one particular idea? We're also listening for things like delusions, hallucinations, or any thoughts of harming themselves or others.
Do you really have to be paying attention and know what to listen for?
You do. And Dr. Birru also emphasizes the importance of considering the context. The person's age, their culture, their medical history. What might be considered abnormal in one context could be completely normal in another.
Yeah, you can't just assume that something is wrong based on your own perspective.
Right. You have to be sensitive and remember that everyone has their own background and experiences that shape how they think and feel.
It's all about understanding the individual. Okay, now I'm curious about the cognitive functioning part of the MSE. What does that involve?
Cognitive functioning is basically how well the brain is working.
Okay.
Dr. Birru highlights several key areas to assess: orientation, attention and concentration, memory, and abstract thinking.
So you're checking to make sure all the parts of the brain are functioning properly.
Yeah, in a way.
Tell me more about how you assess those different areas.
Okay, so for orientation, like Dr. Birru explains in their notes, we start by asking simple questions like, what's your name? Do you know where you are? What day is it today? These questions help us see if the patient is oriented to person, place, and time.
Okay.
If they're struggling with these basic questions, it could mean they're disoriented or confused, which could be caused by lots of things like side effects from medication or underlying health problems.
It's like making sure their internal GPS is working correctly. If they don't know where they are or what day it is, it's hard to function.
Exactly. And for attention and concentration, Dr. Birru suggests different techniques. We might ask them to repeat a series of numbers, either forward or backward, to spell a word backward, or to do a task that requires focus, like tapping their finger in a certain pattern.
So you're giving their brain a little workout.
Yeah, we are.
And then there's memory, both short-term and long-term.
Right. Dr. Birru talks about different ways to assess those.
Okay.
For short-term memory, we might ask them to repeat a list of words or a short story right after we say it.
Yeah.
For long-term memory, you might ask about big events from their past or things they should know from general knowledge.
Right.
The goal is to see how well they can store and retrieve information.
So you're checking to see if their memory is working the way it should?
Exactly.
And how about abstract thinking? How do you test for that?
Dr. Birru mentions things like asking them to explain proverbs or to describe the similarities and differences between things. These tasks require them to think more abstractly, not just concretely.
So it's like making their brain really think.
It is.
Okay, we've covered orientation, attention, memory, and abstract thinking. What's the last piece of the cognitive puzzle, according to Dr. Birru?
The last thing we look at is insight and judgment, which we touched on earlier.
Okay.
So insight, as Dr. Birru explains, means how well the patient understands their own condition.
Right.
Like, do they realize they have symptoms of depression or anxiety?
Okay.
And judgment is their ability to make good decisions, thinking about what might happen as a result of those decisions.
So it's not just about identifying problems, but seeing if the patient is aware of the problems and can make good decisions about their own care.
Exactly.
Wow. The mental status exam is so much more complex than I realized. Dr. Birru's notes are really insightful. Before we wrap up this section, I just want to emphasize how important it is to understand all these assessment techniques for both physical and mental health. It's not just about what healthcare professionals do.
Right.
It's about empowering ourselves as patients to understand what's going on and be able to advocate for ourselves and our loved ones.
You're so right. The more we know, the better we can communicate with our healthcare providers, ask good questions, and feel more confident about getting the care we need.
It's like having a secret decoder ring for the world of healthcare.
I love that analogy.
The more we understand, the more involved we can be in our own health and the health of the people we care about.
Absolutely. It's about being active participants in our healthcare, not just passively going along with whatever happens. So let's take a minute to think about everything we've covered so far.
Okay.
We've looked at the 4 techniques for physical assessment. We've explored all the details of the mental status exam.
Yeah.
And we've gotten so many great insights from Dr. Birru's notes. But we're not finished yet. We'll be back soon to finish up our deep dive with some final thoughts and key takeaways.
Great.
To leave you feeling empowered and with a new appreciation for the power of knowledge when it comes to our health.
Welcome back to the deep dive. We spent a lot of time with Dr. Birru's notes on examination techniques and mental status assessment. And I'm just blown away by all the things healthcare providers do to understand their patients' health. It's a lot more than I ever realized.
It really is. It's like piecing together a puzzle using all those assessment tools to create a full picture of someone's health.
Yeah, that's a great way to put it. And as we wrap up our deep dive, I keep thinking about something Dr. Birru emphasizes, how important it is to remember that every patient is different.
Absolutely. Context is key. Dr. Birru stresses that you have to consider the individual's medical history, lifestyle, cultural background, all of that when you're looking at the results of those assessments.
That makes a lot of sense. You don't want to misinterpret something just because you don't understand the person's individual circumstances.
Right. Like Dr. Birru mentions that certain cultural beliefs or practices might be mistaken for mental illness if you're not familiar with that culture.
It's a good reminder that we need to be open-minded and really try to understand each patient's unique perspective.
It's about seeing the whole person,
Yeah.
not just the symptoms. And remember, these assessments aren't just about finding problems. They're about understanding the person,
Right.
their physical health, their mental well-being, their social situation.
Right.
And using all of that to come up with a care plan that really works for them.
It's like personalized medicine, right?
Exactly. It's moving away from that one-size-fits-all approach.
Yeah.
And recognizing that everyone needs individual care. And, Dr. Birru makes a really great point. Understanding these assessment techniques helps us as patients.
Absolutely.
It means we can ask better questions,
Yeah.
we can understand what our doctors are recommending, and we can speak up for ourselves and our families more effectively.
It's about being in control of our own health,
Right.
not just letting things happen to us.
Exactly. It's about being active participants in our healthcare journey. And